Hey everyone, this is Dr. Tom Hagopian with Peachtree Plastic Surgery in Atlanta, Georgia, and today I wanted to talk to you about a super fun topic, breast augmentations. So let's talk about the different kind of procedures that we can do. We can do a traditional breast augmentation with implants. So you've met with a plastic surgeon, a board certified by the American Board of Plastic Surgery, plastic surgeon. And you've had a great conversation. You've decided what fill you want, what size you want, whether you're getting gummy bear or whether you're getting softer implants, your manufacturer, Allergan, Sienta, or Mentor, and you've decided the augmented look. You're pretty confident that you and the surgeon have the same vision for your breasts, and you're ready to proceed. Well, what are the different things we can do? So we can do the most common procedure, which is putting a smooth, round silicone implant under the muscle. That's the most common procedure done in America. This implant goes through an incision in the inframammary fold underneath the pectoralis muscle and stays on the chest. It is a great procedure for the vast majority of people coming for a breast augmentation. It's the most affordable of the procedures we do. It gets great, durable, long-lasting results, and that is the most common thing that is done in America. Why do we do an inframammary fold incision most commonly? Because it has the lowest risk of capsular contracture, the scar is almost invisible and heals really well, and it's the most durable of the results. You get a muscle. Why do we put it under the muscle most times? Because the muscle gives you extra cleavage, hides the outline of the implant, makes it look a little bit more natural. Why do we use a silicone implant? Because they feel better than saline implants. They are more natural feeling, and most people want a natural look. Why do we use a smooth implant as opposed to a textured surface? Because we're all concerned about anaplastic large cell lymphoma, the breast implant associated disease. The vast majority of implants now are no longer textured, and very few people place textured implants anymore. So that's the most common way to perform a breast augmentation in the United States. It's a great procedure. But let's say you have some special situations. Let's say you are a bodybuilder and you absolutely do not want animation deformity, which is when your pectoralis muscle contracts, it presses the implant down. Let's say you want to avoid that at all costs. Well, you might be a good candidate for a subglandular or over the muscle implant or a subfascial implant placement, where we take the connective tissue, the fascia, the thick fibrous tissue that overlies the pectoralis muscle, we lift that up but leave the muscle down and put the implant in between the two. And then, to prevent you from seeing the outline of an implant, we use fat. We take some fat and we perform fat grafting to the top on the inside of the breast implants. That is called a composite breast augmentation, where we use an implant and fat to create the look we want and you want. That's a great procedure for people who are trying to avoid animation deformity or who don't want the extended recovery that comes with placing the implant underneath the muscle. It doesn't hurt as much when you don't have to elevate a muscle off the chest wall. So that's a good implant. Now let's say you're the kind of person, you want larger breasts, but you do not want an implant. You are afraid of breast implant illness. You are concerned about breast implant associated cancers. You don't want to have another operation later in life because the breast implants are not lifetime devices. There's a lot of reasons why you might not want an implant but still want larger breasts. Well, what we can do for you is something called fat transfer, fat grafting, or making a breast using your own fat. Basically, the way that works is we perform liposuction on an area of your body that you don't want fat, usually the stomach, or the flanks, or the back, and then we transfer that fat to the breast. And now this is great for certain people who have modest goals, want just a little bit of larger breast, and don't want implants. The downside to this is we can't make very large breasts and very large changes to the volume of the breast because we can't put that much fat in at one time. So the way fat transfer works is when you suck out fat, you process it, and then you re-inject it into a place. It has to get blood to live. It gets blood from the tissue that you put it into. So let's say you put it into muscle, or you put it into fat, or put it into the breast. That breast can support a certain amount of avascular fat put into it. Typically, it's 1-to-1, meaning if your breasts are 150 cc's now of breast tissue, you can place 150 cc's of fat. That's how much the breast can support. If you put more than that in, the fat that you put in dies and you get what's called fat necrosis and oil cysts and calcifications, and it's really terrible and no one wants that. So you can't overdo it. Now you put 150 cc's of fat into a 150 cc breast. When all is said and done, not all of that fat lives. As a matter of fact, we think only about 50% of it turns into new fat, or gets vascularized and grows into fat in the breast. And so now you have a 225 cc breast. You've increased by 50%. Now you can do it again, put 225 cc's of fat in, and you get another 50% increase. And you can keep going until you get the size you want. So this takes multiple stages to get very large results, and the more you do it, the more chance there is of fat necrosis and things like that. So it's not good for people that have very large goals. If you're an A cup and you want to be a D, you need an implant, or you really should have an implant. Otherwise, you're going to be going through this procedure a lot. The other thing is fat grafted breasts don't get a lot of upper pole fullness. Fat, when you place it in, it settles. It goes down and makes a teardrop shape. Well, a teardrop shape doesn't have a lot of volume up top. It gets scooped out. The only way to get lots of cleavage is with an implant. An implant, the volume stays where you put it, generally speaking, unless you age, and then as you age it falls. But not like fat does. Fat can't really make a lot of difference up top. So if your goal is to have lots and lots of cleavage, this is not a right operation for you. No matter how many times you do it. You get beautiful breasts. It's just not the look of having a lot of cleavage on top. So those are kind of the two main ways we augment a breast nowadays. They're both great operations. They're only good for certain people or good for other people, but you need to have a long conversation and consultation with a board-certified plastic surgeon. Now, why do I always say board-certified or board-eligible plastic surgeon? What do I mean? There's lots of plastic surgeons out there. There are lots of people, lots of doctors that place breast implants. There are lots of doctors that call themselves plastic surgeons. It is not illegal for anybody to call themselves a plastic surgeon as long as they are a physician. There's no law against a family practice doctor calling themselves a plastic surgeon. So you need to be careful as a consumer to make sure the person has the right training. There is one board certification for placing implants. There's only one board-certified doctor that is qualified to place breast implants, and that is a board-certified plastic surgeon by the American Board of Plastic Surgery if you're in the United States. There are no others. To do a rhinoplasty, there are two. There's the facial plastic surgeons and the plastic surgeons by the American Board of Plastic Surgery. Both are trained and qualified. To do eyelid surgery, there are three that are equally qualified to do those eyelid cases. There is only one for breast implants. I say this because the person that places the most breast implants in all of Los Angeles is an otolaryngologist, or ENT, who took a course on cosmetic surgery, which is not what I would consider adequate training, in my opinion. So you have to be careful, and the reason I say that is not to say that some people that they go to don't have good results, but they are not trained to do what we do, to place them correctly. They don't know the risks as well as we do, and they don't have the same results. When non-plastic surgeons perform plastic surgery procedures, they have higher complication rates and higher rates of dissatisfaction. And that just kind of makes sense if you're doing something that someone that's trained for 6 years to do these procedures is going to be better at it than someone that took a weekend course or even did a 1 year of training for it. So just be careful when you do that. Look for board certification or board eligibility. If you're board eligible, you've also had a lot of training. I am currently board eligible by the American Board of Plastic Surgery. I have done over 2,000 procedures, and I'm very qualified to do this. I'm just early in my career and working towards board certification. That's what you should look for, and that is super important. So now you've met with a board certified or board eligible plastic surgeon, you've had your conversation, you should be good to go. Take a look at our patient decision aid that we've made. That'll help you make good decisions. It's full of very high quality data that comes from a group consensus of Aesthetic Society plastic surgeons and from patients. It took 2.5 years to make. It's a brilliant document. The Aesthetic Society fully endorses it. It's on their website, surgery.org/PDA. So this was a large topic. I hope you enjoyed the video. If you do, please, if you're watching this on YouTube, like and subscribe. If you're watching this on Instagram, then cool, what's up? Nice to see you guys again on Instagram. That's my main hub for all of the things that I like to do, all the messaging I like to get out. I'm at Dr. Thomas Hagopian. You can find me on YouTube. Dr. Tom Hagopian is my YouTube channel. And I'm also frequent on Reddit, where you can come and ask me a question. I'm Dr. Tom PS on Reddit. You can find me on the r/plastic surgery subreddit. I'm on the r/reduction subreddit as well often. And I'm sure I'll wander around some other subreddits here and there based on whatever I'm interested in that day. But send me a message. I'll be happy to reply to you. I do all my own social media, so I'll be the only one replying to you. It's really great. I answer questions all day long. If you are on YouTube, hit that button, like and subscribe, and then you can see more. You'll be one of the 100 people that will watch this video on YouTube, and it'll be awesome, and we'll be like a very small, tightly knit community. Anyway, it was great to talk to you guys. I'll see you next week. Bye.